And we'll start recording. So I want to welcome everyone to our second live webinar, launching our new Prevention Technology Transfer Center Network Marijuana Prevention Education Toolkit. We're really excited about this new toolkit. There's a lot of work went into this, and we're really excited to get it out there in the field for you all to use. So we're going to go over what the toolkit looks like, some ideas and tips for using it, and then we have a portion at the end where we'll certainly any questions you have about the toolkit, but also an opportunity to weigh in on some of the other issues or training and technical assistance needs you might have around this topic as we continue to do our work. So let's go ahead and start. So just to let you know, of course, this is a PTTC program funded by SAMHSA as part of the overall PTTC network program. And as I said, here's our agenda for this afternoon. I'm going to give a brief overview of the PTTC network for folks who may still be new to this program, talk about our focus areas and our working groups. The bulk of our webinar will take a tour of the products or the tools that are in the toolkit. And then at the end, an opportunity for questions and then feedback for future training and technical assistance development. So just to start with a brief overview of the PTTCs. So if you're not familiar with the PTTCs or the Prevention Technology Transfer Centers, this is SAMHSA's model, regional model for providing training and technical assistance for the prevention field. And really, we have really two main purposes: is to improve the implementation and delivery of effective substance use prevention interventions, and to provide training and technical assistance services to the field. We want to make sure those services are tailored to meet the needs of the recipients, which is why we have this regional model. We, of course, want to make sure it's based in prevention science and also providing opportunities to leverage the expertise and resources available through the network and other alliances. So there's 10 regional centers across the country. I actually didn't introduce myself. My name is Scott Gonyer. I'm the director of the New England PTTC based here in Augusta, Maine. So we serve the 6 New England states, but as you can see on the map, 9 other regional centers. So if you've not connected with your regional, can we keep ourselves on mute for now until we get to the end? Thank you. So yes, there's 9 other regional centers. There's also 2 national specialty centers, the National Hispanic and Latino PTTC and the National American Indian and Alaska Native PTTC. So definitely encourage you, if you haven't yet connected with the PTTC that serves your region, and I definitely encourage you to do that. So across the network, we've developed 7 areas of focus for which we've developed some national work groups to develop training and technical assistance services. And so those 7 areas include community coalitions and collaborators, culturally and linguistic appropriate practices, data-informed decisions, evidence-based interventions, marijuana risk, opioid education, and then trauma and drug-exposed children. So the way this has been operationalized is there's a work group for each of these 7 areas. It's made of representatives from multiple centers across the country, and what we've done is in our first year, we convened, met bi-weekly to kind of do an assessment and figure out what are some first tools or training and technical assistance services we can offer out to the field that can be deployed across the country. And so for the purposes of our webinar, we're talking about the marijuana risk work group and our first toolkit that we developed. So I am the chair of our marijuana risk work group, but we also have members from multiple centers across the country, which you see listed here. So we have folks from the Great Lakes, Pacific Southwest, Northwest, as well as the 2 national specialty centers. So we all came together through multiple meetings to create what we're about to go through. And so this is kind of our mission statement for the marijuana work group, basically to develop training and technical assistance tools, products and services related specifically to marijuana risk education and prevention that can be deployed across the country. So we convened last summer, and as I mentioned, met pretty regularly to develop these first year one tools. So let's talk about the toolkit. So there are basically 4 components, and I'm going to kind of give you a tour of each of these individually. So the 4 tools are, one is a myth and fact sheet. So it includes 7 myths around marijuana and the science that counters those myths. The other tool is a cannabis glossary, and so it includes different terms, and we'll look at that more closely in a minute. But also 2 slide banks. So one slide bank that's on cannabis and the adolescent brain, and one that's on varied forms, potency, and the health effects of today's cannabis. So we're going to go into each of these more in depth to give you an idea what they look like and how to use them. But to really talk about what our overall goal with this toolkit was to provide a researched and vetted tools that you can feel confident using in your prevention work. We know that there's a lot of changes going on in our states, whether it's legalization, medical marijuana, other types of laws and policies. We know it's a really rapidly changing landscape, but it's still our job to do this work of educating the public and engaging in prevention. So what we're trying to bring to the table is something, again, that's some tools that are researched and vetted that you can feel confident using in your work and not having to reinvent the wheel in your education efforts. So first, I'm going to show you where you can get the toolkit. So I'm going to go to my web browser here. So if you go to the PTTC network website, so that's pttcnetwork.org. So there's 2 ways you can get access to the toolkit. Right now, it's a featured page on the home page of the PTTC network. So if you go to this link here, it will take you to this page here, which lists each of the 4 products individually. So there's a brief description and then a link to download this. So these are all available for you to download and use right away. So this is one way you can get to that page. The other way you can get to it is on the menu here at the main website. We have a drop-down box here under projects, the PTTC focus areas. So here you can see that graphic I showed you a little while ago. And then there's a link for the marijuana risk products, which takes you right to the same page. So 2 ways to get that. So as I said, each of the 4 components, there's a link to download and has a brief description of what they are. So let me go back to my slideshow here. And certainly after the fact, if you have any problems locating and downloading the toolkit, you can always send us an email. We can help you out with that. So let's talk first about the fact and myth sheet. So as I mentioned, this fact sheet covers 7 common myths or misunderstandings as related to marijuana science. So for each of these 7 myths, we've countered it with what the current evidence and science is, including the citation. So this is a well-cited and sourced document. And the goal of this is to provide prevention providers a tool to help them respond and educate the public around these common myths or misunderstandings. So now actually I'm going to switch again to, hold on. Oh, here we go. Okay, hopefully everyone can see that. It helps if I hit the share button. All right, so this is, I'm going to zoom that out a little bit so you can see it a bit better too. So this is the marijuana myth and fact sheet. So sort of the way it's laid out is we talk about the myths. So example here, marijuana is harmless. And then under the facts section, we include the science that counters that. So it includes footnotes, which are on the second page. So we have all the references here. So if you're interested to look at the full research around this, you have the links and the citations to do that. But then also, as you're talking and doing the education, you can explain that this is all sourced and cited on current research. So we have a myth on marijuana is harmless, marijuana is not addictive, marijuana is not as harmful as cigarettes and other tobacco products. Marijuana is used to treat cancer and other diseases. All marijuana is natural. Legalizing marijuana will help solve the opioid epidemic. And then marijuana does not affect driving. So again, for each of these, we kind of provide the science that shows and counters those myths. So let me go back to So as we mentioned, really this is to kind of help arm you with the current science around these 7 misunderstandings and just some ideas of how you could use this. So you can use it as a handout itself, tabling events. So maybe you have a health fair or some other kind of community event where you're tabling. You can provide this as a resource. You could use the content for social media posts. So if you have a Facebook or a Twitter account, you can use the content for that. Certainly, for Drug Facts Week, which will be coming up soon, there could be some great content for, if you're doing an event around marijuana, this can provide some great information for that. And then also, of course, National Prevention Week. We know there's a Marijuana Prevention Day as part of that week, so it can be whether it's social media that you're doing at that time or some other kind of events. And then I'm sure there's probably other ideas you can think of around this. And actually, if you have some great ideas around that, definitely put those in the chat box to let us know what you have for around that. All right, so the next tool that we're going to cover is the Cannabis Glossary. So kind of the thinking behind this is that there's a lot of different terminology that's used when we're discussing marijuana or cannabis, whether it's the slang terms that are used for different products, whether it's the names and references to products themselves. The goal of this is just to kind of help the field be kind of competent and literate when we talk about this topic, or if you hear certain terms, to make sure you're familiar with what they mean. So this is really more of a reference document, not necessarily something intended to be used as a handout, but just something that you can use for yourself and your coalition members and your staff to be more familiar with some of these terms. So now I'm going to switch to switch back to this. And let me start back at the beginning here. So just to give you a very quick tour of this. So we have a few different sections. So the first section looks at terminology around growing and cultivation, anatomy of the plant, some of the references to that. Production processes is something you often can hear a lot of terminology used in discussions around legalization and different kind of law changes or proposals. You hear a lot of different terms around production processes, extraction processes, references related to the cannabinoids. So some of the different cannabinoids and terminology related to how they interact. Different types of products, so concentrates, edibles, hemp, marijuana, what we mean when we use the term recreational use, a retailer, those kind of terms. We have some terminology in here related to medical specific product types, so such as the FDA approved medicines like dronabinol, nabilone. Some of the slang terms that are often used around cannabis, and then it includes a link where you can see more of those, because there's obviously quite a bit. and that can often change and evolve. Terminology around product use, so dosages, routes of administration, dabbing, vaping, other different routes of administration, terminology related to some of the product effects, and then some other miscellaneous terms. So again, the idea around this is really more of a reference for you. So again, if you're sort of in, maybe you're in a panel that has folks from different sides of a discussion around legalization. So you're going to have folks who are, in the cultivation side of things, just to be familiar with the type of terminology that they may be using. So again, it is a reference. Some certainly you can share with coalition members and other stakeholders to help them become aware and literate with some of the different terminology, but probably not necessarily something to use as a general handout as with the myth and fact sheet. All right. Just check to see if there's any other questions. All right. Okay, so next we're going to talk about the 2 slide banks. So the idea with these slide banks was to, we know that, in your role in prevention, you'll often get called to do maybe a presentation for a conference, or maybe it's, an educational session in your community. So the goal behind this was to create some slide banks that you could use that's already been researched, embedded as part of these events. So we created 2 different slide banks. One that's on cannabis and the adolescent brain. So it focuses on the pharmacology of marijuana and how it affects the brain, also the pharmacokinetics, how it gets processed through the body. And then another one that's on the varied forms, potency, and the health effects. So it covers the different routes of administration, the different forms or products, and some of the trends around potency and some of the known health impacts. So these have been researched and vetted by our work group. They can be used separately, so you could use each of these slide banks independently, or you could combine them into one presentation. I think it's all going to depend on how much time you have for a presentation and sort of what the asks are in terms of the type of information that you cover. The other thing too is you may want to integrate these slide banks into some local data, or a slide bank that's on some of the local issues. So you don't have to do these just as standalone slide banks. You can integrate it into sort of your local information. So now I'm going to switch to the first slide bank to give you a tour of that. Of course, it helps if I... Oops. Hold on, technical difficulties. All right, sorry about that. Let's start with cannabis and the adolescent brain. So can everyone see those okay? Let me know if you can't. All right, so cannabis and the adolescent brain. So I'm just going to give you a quick tour through this slide blank to show you what's in here. So we start with acknowledgement slide to talk about the work group that put it together, and a couple of slides talking about the purpose of the PTTC and that map. So we do ask you that you keep those in there just so we can kind of provide that acknowledgement and also help spread awareness of the PTTCs and the resources that they can bring to your region. So the first half of this really is focusing on the impact on the brain. So starting with the anatomy of the brain, the different sections. We do include a link to a video here that if you have time, you can play. So it's really at your discretion depending on how much time you have to do this. Changes in the brain structure, We include sort of the timeline of how different parts of the brain develop, and sort of the parts of functioning that they govern. Talk about the pathways for different substances, including marijuana. We talk about the endocannabinoid system. That's something that often comes up in discussions, particularly around marijuana policy. So we include a section here to kind of describe what it is, what it's involved in terms of development and functioning. The fact about how the THC molecule is very similar to the endogenous chemical, and how that affects our brain. Talking about the different receptors across the brain. Oh, I saw a question in here about notes. So yes, there are, and after I end this particular slide bank, I'll show you where we did include speaker notes with each of the slides, and I'll show you what those look like in a minute. Talk about some of the research that's showing how cannabis can affect the adolescent brain. So the links with poor academic performance, deficits in attention, information processing, and memory. Some of the structural differences, or the physical differences that have been observed between cohorts that do use cannabis and those that don't. Some of the functional differences that we can see between those cohorts. And then the slide bank goes into pharmacokinetics, and that's really looking at how the body processes THC depending on the route of administration. I've actually test-driven these slide banks in a couple of presentations I've done. So definitely, if you don't feel familiar with the term pharmacokinetics and what it means, definitely you might want to do a little bit of sort of side research on that, so you feel comfortable talking about that, although we do have that in the speaker notes as well. So we talk about oral consumption, what that looks like. So what you'll see in each of these slides is we include the onset of effects. So how long does it take between consumption, between when the effects start showing up. So in this example, we're talking about oral consumption, edibles. We talk about that the onset can be delayed from anywhere between 60 to 120 minutes. We talk about then how long the effects can last. So in this example, the effects of oral consumption can last 48 hours. When the THC levels can peak, so 2 to 5 hours in this example. And then bioavailability. So what that refers to is like how much of the THC becomes available after consumption. So an example with edibles, it's a pretty low amount, 6 to 7%. Of course, this is part of the reason we have these risks, accelerated risks around the edibles, because the effect is so delayed and bioavailability is so low, people tend to overconsume. And then all of a sudden they have a lot more of this in their system, and then the effect takes place. And that's where we're seeing some of the significant effects along with that. So that's the structure of each of these slides, is very similar with the onset, the time for the effects, and the bioavailability. So lots of different, so there's obviously some of these are more common than others. So oral ingestion, smoking, some of these other are less familiar. So if it's something you feel like your audience isn't necessarily going to be interested in or is not relevant, you certainly don't have to include them. So, the rectal intravenous, certainly not as common as others, but just to make sure we have the complete information, we wanted to have it in the slide bank. We also talk about the distribution, so the fact that it's lipophilic, so it can be uptaken in various fatty parts of our anatomy, and how the residual concentrations can remain in those body parts, in those organs. And then we talk about the excretion elimination process, and then the quitting and detecting use. So how long is the THC half-life, and how long can it be detected? And then for both of these slide banks, we end with slides to learn more about some more resources that are available through the PTTC network. Certainly, you'll want to add in your own local resources and what's available through your coalition. And then at the end, we have all the references that are cited throughout the slide bank. So I will show you here, let me go back to the beginning. There's a question about speaker notes. So we do have down below speaker notes for each of the slides. So you'll just want to make sure when you're doing this, you have your PowerPoint program set up so that you can see those, or make sure that you have them printed out, whatever obviously you're most comfortable with. But certainly, but for each of the slides, we do have some speaker notes here. But definitely as you're implementing these and using these slide banks, if there's anything that's unclear, if you have follow-up questions, definitely reach out to us to have our contact information at the end, and we can help out with that. I see a question about will the slides be emailed? Yeah, we'll make sure after the webinar, we'll send an email out to the group with a link to that page, but you can also go to the PTTC network website to download them there as well. But we'll send something out after the webinar to make sure you have that. All right, so let me go back to this. So I kind of already covered this, but some tips and guidelines as each slide bank does include notes. So we do have speaker notes on each of the. Oops, I'm sorry. Let me go through the other one. I'm getting ahead of myself here. Let me show you roots of administration. All right. So before I go into these slides, I'll show you the same thing, that each of these slides has speaker notes here, as with the other one. So we'll start at the beginning. So this is the roots of administration. Similar, we have the acknowledgements at the front. Certainly, if you're going to use these as a combined presentation, definitely whatever order you're going to do these in, take the slides out. You don't have to do this twice. So we talk about how the marijuana today is very different, to kind of set the stage from the marijuana 50 years ago. We start out with kind of giving an overview of what the different categories will go through. So starting with the smoked forms of marijuana, so some of the kind of forms that have been around for a long time, the joints, blunts, pipes, those kind of forms. And then what we do is through each of the sections, we intersperse it with some of the evidence we have so far around some of the health effects. So for example, in this section around smoking or inhalation, we talk about some of the research that shows some of the risks to the respiratory system or the health effects. So coughing, more frequent lung illnesses, longer recovery times, higher risks of lung infections. We include this reference that we're in the state of California. It's actually registered as or recognized as a carcinogen. Research around secondhand smoke, effects on the heart, so how it can increase the heart rate. Talk about the cyclical vomiting syndrome or cannabinoid hyperemesis syndrome. Next, we go into the vaping devices, which obviously is a big area of concern lately with the EVALI outbreak. So talking about what sort of the ends or vaping devices, what they are, what some of the different terminology is related to this. And certainly in your region, you may have different slang terms or references to those. So certainly as you present this, you want to make sure you include those. In case people are not familiar with how they work, what they look like, there are some images here to just kind of give a sense of what they can look like. Obviously, there's a lot of variety out there. some of the different ways that they're used, so the dripping, the dabbing, acknowledging that despite them being their term vaping, that it's really not a vapor, it's actually an aerosol. So to try to kind of correct that misperception around what the actual, what is actually being produced. The anatomy of a vape pen, again, for your audience, if your audience is not very familiar with what they look like, and there's an opportunity to kind of explain to them how they work. We, of course, include a section talking about Juul, those specific devices, since they are such a big part of the vaping market. We include this reference to a great article that was done in the New York Times. It looks at some of the marketing pieces around Juul and how it's appealing to teenagers. And I'll talk about, after I go through this one, I'll talk about one of the asks we have around these slide banks is that you don't make any changes to any of the slides. You certainly can shorten if you need to for time, but we don't want you changing any of the content of any of the slides. But the one exception is with this section where we talk about the CDC health advisory. If you've been following this, as I'm sure you have, you know these numbers have changed or changing quite often. In fact, these numbers here are a little bit outdated. So certainly if you want to update this slide to keep up with the current numbers, or national numbers, you certainly can go in and update those numbers and update the dates. We just ask for the rest of the slide banks that you don't make any changes to any of the content. So reported health effects around the vaping devices. Next, we go into the marijuana concentrates. So talking about sort of general overview, what they are, the potency issues around the concentrates, the fact that these are legal products in states that have gone forward with legalization. A few images, again, for folks who may not be familiar with what these look like, just to give them a sense of what the products look like and how they're used. And that's there talking about the different ways that they can be used with the oil pipes, oil rigs. We include this slide that's talking about some of the public safety aspects with concentrates, particularly as they're made at home. So some of the issues with explosions, particularly in situations that are not well ventilated. Then we go into the edibles and the oral consumption. So talking about the way that they get processed and the delayed effect, and how they can really be made into a lot of different types of products. We do include some pictures again to give a sense of the great variety of products that can be created in the edible market. Another thing you'll want to highlight is one of the risks around the edibles is, particularly with young children, is the fact that especially the candies and those kind of products where they look almost indistinguishable from products that don't have THC in them. So some of the poison exposure risks for very young children. So that's something you can highlight with this graphic. We do include a slide on tinctures, what those products are and how they're used, and then the topical applications, while they may not be as prevalent. Again, to make sure we're kind of covering the full spectrum, we want to include that information. And also, I've done enough of these presentations where people will come up and ask questions about topical products. So we felt, it was good for you to have this information on hand. So following the different categories, we do go into a discussion of potency, talking about how rapidly the average potency of marijuana products has escalated. That's both in sort of the pre-legalization age and then even the current illegalization, commercialization age, where the potency continues to increase across the board. We include this graphic to show graphically what that looks like. We haven't been able to find a graph that goes past 2010. We did a lot of research to find that. We couldn't come up with anything, but we still wanted to include this just to kind of provide that visual, because sometimes percentages aren't, they don't get the same point across as a visual graphic will. So that's the reason we included this, even though it does stop a few years ago. If anyone does happen to know or be using a more current graphic that goes, to current times, definitely send that our way, and we can include that or add that to the slide bank. And then we include a little summary summarizing everything that you talked about, and then we add it, and we have the same slides here at the end with the references and whatnot. All right. So let me just go here and see if we have any questions so far about the toolkit. Okay, I see a couple questions about the myth sheet, and I will say that is something we discussed. And if you feel like you want to frame that a little differently, you certainly can do that. I mean, because we kind of anticipated this. The fact of myth sheet could be used in a couple different ways. I mean, one, it could be used as a handout in different scenarios, but the other piece is just to kind of provide you, the prevention professional, with that information. So maybe, if you're not comfortable putting this out, with the myth framing, you can still use the science, and you can still use that information to, deal with those misunderstandings and misperceptions. So if you want to frame that a little differently, either in your social media posts or however you want to share that information, certainly feel free to do so. But we kind of anticipated there'd be a couple different ways that would be used. The end goal really is just to have that science in one place, where if you are in a situation where someone is challenging whether or not marijuana is addictive, you have the science, the cited science that you can provide. So if you don't want to provide that exact handout with that kind of framing, you can still have the information, and then you can frame it in a way that you're more comfortable with. Let's see if there's any other questions. So notes. Yep. So we do have the notes included. What is the intended demographic for these slide decks? So we definitely have more adult audiences in mind. So I wouldn't say these are necessarily ideal for youth audiences, particularly with, the roots of administration, with the different pictures of the different types of products. That's something I probably wouldn't I'd think about whether or not I wanted to use that in a setting where I have like a mixed audience. But otherwise, in terms of adult audiences, they are kind of universal, and really, we are calling them slide banks and slide decks. So we kind of will defer to you in terms of what you think is most relevant or most important for any particular audience. If you have a broad audience, that may inform which slide to use. If you have a very specific audience interested in very specific aspects of marijuana science, that may inform what slide to use as well. So we try to make it as broad as we can, so it has as many different applications as possible. So question about the graphics. So yeah, so if you want to change graphics, as long as you keep the content the same, like if you don't want to use like the pictures of the concentrates, for example, you can just take that slide out or take those pictures out. It's just the actual content itself we don't want you to change. Any other questions about the toolkit? How long does the presentation take? So, I think it's going to really vary depending on how much time. If you want to cover the whole thing, I did a 4-hour training in Rhode Island, and I was able to include both slide decks as well as some additional content. So I would say, if you were just doing those 2 slide banks, I probably wouldn't do any less than an hour and a half. 2 hours if you could, just because in my experience, and I'm sure your experience as well, is this is, a topic that generates a lot of questions and discussion. So, if you're going to use all the slides, I think an hour and a half at least to 2 hours is probably what you want to look at. All right, so if there are more questions, feel free to put them in the chat box. Still got some time left. But I did want to talk about, so our work is ongoing. So this toolkit I just shared with you is sort of the year one products of the PTC marijuana work group. We are already working on products for year two, and want to just kind of give you a flavor for what some of the topics that we're looking at. One area of content we're looking at is marijuana and pregnancy and breastfeeding. We know that's a big concern for SAMHSA. We know it's a concern across the country. So as a work group, we're talking about some content we can develop around that for the field. So stay tuned. I don't want to get too much into detail on what we're looking at because things can change. We're still kind of early phases. Also some content around vaping. Certainly we know vaping crosses sort of both the nicotine space and the THC space, but we know with the E-Valley outbreak and the rising numbers amongst youth, we know that's an urgent issue. So we're looking at developing something around vaping. The other content area we're looking into is motivational interviewing and looking to see if there's some techniques from that or our training that we can develop that would to use those techniques in engaging sectors in marijuana prevention, because we know the controversial nature of this topic. It can sometimes pose some challenges in terms of engaging, whether it's specific sectors or the community on this topic. So looking at, are there some MI techniques for prevention, that we could provide some guidance or training on to help you kind of build your coalition or your community efforts around marijuana prevention. Sorry, I saw a question about what is E-Valley outbreak. So E-Valley is EVALI, and that is the lung injury outbreaks. That's sort of the acronym that's come up around that. If anybody I don't know the acronym off the top of my head. If someone is more familiar with that, I can't remember exactly what each letter stands for. If somebody knows what that is, they could put that in the chat box. That'd be great. All right, so now we have a couple questions for you, because as we are starting to talk about some year two products, we would love to get your input onto other things that we should be looking at, because again, that is our mission statement for our work group is we want to design and put out trainings and technical assistance products that are going to be helpful for the problems that you're dealing with right now around marijuana. So the first question I have, and you can either unmute yourself if you'd like to share this, or if you want to put it in the chat box, whatever you're most comfortable with. But our first question is, what are some challenges you are facing in your marijuana prevention work in your state or community? And that could be anything, any kind of particular roadblock or barrier that you're dealing with. So you can put that in the chat box, or if you want to unmute yourself to share, you're certainly welcome to do that. So I see someone saying dispensaries and parent use. Misunderstanding what prevention is. High number of marijuana grows in a school district, which has shifted perception. Yep, that's one we hear a lot. Oh, okay, you got a lot of them, all right. CBD versus THC. Decrease in stigma, giving kids a sense that marijuana is harmless. Community norms. Yep, norms is a big one. low perception of harm, even with side effects. Yeah, that can still be a challenge. So definitely seeing some common themes there. So we're saving this chat at the end. And so one of the things we're going to do is we've already done one live webinar, so we're going to kind of pull these together as a work group to look at and to see if there's other products we should be looking at, which is a segue into the next question. So thinking about those challenges, what are some other trainings or technical assistance tools or services you would like to see developed that could help you with your work? So you're listing some of the challenges you're facing. So what is it that you think that either your regional PTTC or our work group could develop that would help you deal with some of these challenges? And again, if you want to unmute yourself to share, you're certainly welcome to do that. Okay, see, evidence-based policies, practices, or programs that are geared toward marijuana prevention in youth. Stats on the effectiveness of prevention along with easy to understand definition of what prevention is. Okay, great. Other ideas, other either trainings or tools that you think that could be helpful with some of the challenges you're facing? Okay. All right, you've got a lot of them now. Good. Tools for youth demographics that are tailored for them. Trainings on the dangers of cannabis use as it relates to driving, operating motor vehicle. Curriculum, slideshow curriculum for teens. Okay. Teen-led presentations. That's a good one. All right. All right. Well, you got a lot of great ideas here. So you're gonna, I think you're gonna set us up for the next 3 years, which is good. So definitely feel free to keep putting more of those in there. As I say, we're saving all of these to take back to the work group to inform, our future work. Also, we're going to share these with the other PTTCs as well. So maybe something your regional PTTC can take on too. So any last questions about either the toolkit or anything that we've talked about before we wrap up? I'll give you an extra 10 minutes of your afternoon. Oh, I think TikTok videos to post. Someone's first going to have to explain to me what TikTok is. I've seen that, but I don't really understand what it is. All right. Well, definitely want to thank you for joining us. So just the last couple of things. One is just so, again, if this is your first introduction to PTTC and the PTTC network, definitely encourage you to visit the website to learn about some of the other resources that are available. Certainly, we cover a lot of different content areas when it comes to doing prevention and evidence-based prevention. If you haven't been to the website, pttcnetwork.org is where you go, and that's where you can also find your regional PTTC. And if you're not sure, each of the regions lists the states that they serve. So definitely encourage you to look into that. A lot of great opportunities there for collaboration. I do just want to plug, if you are going to the CADCA National Leadership Forum and the SAMHSA Prevention Day, we do have 2 PTTC workshops that are going to be part of the SAMHSA Prevention Day on Monday, February 3rd. One is actually an overview of the PTTCs, which is during the 11:30 to 12:30 workshop block. So if you want to learn more about what the PTTCs are and how to say it, definitely go check out that workshop. There's also a workshop that I'm a part of from 1:45 to 2:45. Marijuana Facts, the focus on prevention with special emphasis on adolescents and pregnant women. So if that's an area that you have some challenges in, definitely encourage you to check out that workshop. And I'm not just saying that because I'm one of the presenters. So if you're going to be at National Harbor, definitely come check us out. Here's my contact information. If you have any questions following this webinar that you didn't get answered or you didn't put in the chat box, please feel free to send me an email. If you're on Twitter, I'm on Twitter. Our PTTC is on Twitter, and there's also a Twitter account for the larger PTTC network. So follow us there. And the last thing is Aaron will be putting into the chat books a link for a GIPRA post-event, basically an evaluation webinar. Aaron's just putting it up now. If you could please go to that and complete that, just to provide some feedback on this webinar, we would greatly appreciate it. The PTTC network is we're just starting year 2, and any opportunities to get feedback on how we can better serve you and your work is always super helpful. So please, it's a very short survey, so if you could take just a couple minutes to complete that, that would be great. But I want to thank you once again for joining us. As I mentioned, this will be recorded, so if you had colleagues who couldn't join us, we'll post this just as soon as we can, so people will be able to view this. And good luck, in all of your efforts, and if we can be of any service, whether it's our PTTC, your regional PTTC, please definitely connect with us. We want to help you in all your work. So thanks, take care, and enjoy the rest of your afternoon.